Order. Peter Aldous to move the motion.
Thank you very much, Sir Mark. I beg to move that this House should consider community pharmacies. Sir Mark, it's a pleasure to serve with you in the chair, and I thank the Backbench Business Committee for granting this debate. Its purpose is threefold. Firstly, to thank community pharmacists for the great work that they have been carrying out in towns and cities for around 175 years. It was in 1849 that John Boot opened his first shop in Nottingham. More recently, the sector stepped up to the plate and were key players in delivering the COVID vaccination rollout. Secondly, I wish to acknowledge and support the government for recognising in their delivery plan for recovering access to primary care, published in May, the key role that community pharmacists have been asked to play in the future of primary care. And thirdly and finally, and probably most urgently, there is a need to address the enormous pressures that community pharmacists currently face. If this is not done, the sector could well cease to exist in large swathes of the country and will be in no fit state to perform the role for which they have successfully auditioned. There are, Sir Mark, clear comparisons to be drawn with the current state of NHS dentistry, and it is vital that action is taken to prevent a repeat of this particular nightmare. A community pharmacy, previously known as the chemists in the UK and still known as the drugstore in the US, are retail shops which provide pharmaceutical drugs as well as other personal products. There will be a qualified pharmacist available to issue medical prescriptions and to provide advice and guidance to customers on both those prescriptions and over-the-counter drugs, as well as on general health problems. Community pharmacists should be distinguished from the solely dispensing pharmacies that are located in medical practices and in hospitals. Both during the research for this debate and over the course of the years, I have noted that in some places, relationships between GPs and community pharmacists can at times be fraught and strained. This does need to be addressed if the government's plans for improving access to primary care are to be successfully delivered. In preparing for this debate, I have visited both the Kirkley pharmacy at Kirkley Mill in Lowestoft and Boots in Beccles. I would like to thank them both, as well as Tanya Farrow and Christina Bolton from Community Pharmacy Suffolk, for the advice, information and support they have given me ahead of this debate. So, Mark, community pharmacies are made up of both privately run businesses and corporate chains. It is important to emphasise that both these groups are going above and beyond what any business could reasonably be expected to do so as to keep their shops open, and it is the framework within which they have to operate which is at fault, and not them. The former, those private businesses, are quite often working ridiculously long hours for no reward in the service of their local communities, whilst the latter, those corporate chains, are using retail sales to subsidise the pharmacy side of their operations. It is clear that if reform is not carried out urgently, then the steady stream of closures will turn into a torrent. On 19th of July, my honourable friend the Minister, and it's great to see him in his place, in an answer to a written question that I had submitted, confirmed that in the first 6 months of this year, the number of pharmacies in England had reduced by 222. Yesterday, I was advised that Boots have announced that their shop in Orwell Road in Felixstowe, in the constituency of my right honourable friend, the member for Suffolk Coastal, will close on the 18th of November. So Mark, whilst their number is falling by the day, there are approximately 10,800 community pharmacies in England. As I've mentioned, they do great work, and it is in recognition of this that the government announced on 9th May that they will play a central role in the delivery plan for recovering access to primary care, with £645 million being provided to support a pharmacy-first service. This will include expanded treatment options for 7 common ailments, including earache, sore throat and urinary tract infections. Community pharmacists will also be able to assess patients and supply certain prescription-only medicines without a prescription from a GP. This vote of confidence is welcome, but there is a concern that due to a real terms reduction in funding, about which I shall go into more detail shortly, there is an element of robbing Peter to pay Paul. What is now needed is the detail around how Pharmacy First will work so that integrated care boards, such as the Norfolk and Waveney ICB, can set about its implementation. There have been no further details since May, and I would be grateful if my honourable friend the Minister can advise as to when this further information will be published. An important part of the future of community pharmacy is for pharmacists to be independent prescribers. By 2026, newly qualified pharmacists will be able to start work having received the necessary training to be independent prescribers as part of their qualification. There is a need to ensure there is enough support also to enable existing community pharmacists to also be trained as independent prescribers. To become independent prescribers, pharmacists will need the support of a designated prescribing practitioner as part of their training. There needs to be sufficient investment to ensure that this can happen, as designated prescribing practitioners will be required to support both those studying for their foundation pharmacist year in 25-26, and as well the existing community pharmacists wanting to be trained as independent prescribers. Both will require 90 days in a prescribing environment. So Mark, community pharmacists are under extreme pressure on multiple fronts: financial, workforce and regulatory, with many rules dating back to the 1930s. Medical supply instability is particularly acute. This puts operational pressures on pharmacists, imposes financial burdens on their businesses, and creates worrying delays for their patients. Two of the biggest and interlinked challenges facing the sector, and indeed the whole of primary care, are access to services and the sustainability of the workforce. An increasing number of pharmacies are now providing core hours only due to workforce challenges and financial sustainability. This means that fewer are offering services in the evening, at weekends, and over bank holidays, and in some cases, they're having to close much earlier during the day. Whilst the introduction of pharmacists working in general practice is to be welcomed, it has had negative consequences of making it more difficult for community pharmacists to recruit pharmacists. A lack of access to pharmacy services cascades through other parts of the health system, to general practice, to the number of calls to NHS 111, to appointments to the out-of-hours service, and to visits to A&E. So Mark, funding has been cut in real terms by 30% over the past 7 years, and as a result, so as to remain viable, community pharmacists are cutting back on the discretionary services that they provide. This ultimately leads to permanent closures, 461 by Lloyds, and the 300 announced by Boots in June. So Mark, the 30% real terms funding reduction accompanied by inflationary pressures and workforce shortages, has driven up costs and has led to reduced hours and permanent closures. The £645 million for the new Common Conditions Service announced in May is welcome, but it does not address the underfunding of existing core services. There is a need for a stable, long-term and sustainable funding commitment which can be delivered through a review of the community pharmacy contractual framework. This means not only additional funding, but also alignment of care pathways and the provision of incentives within the primary care system. This funding crisis has further knock-on implications, with pharmacists being unable to spend as much time with patients as they would like, and with the withdrawal of services such as free deliveries, particularly to care homes, and as well as the monitored dosage system boxes, which are so important to so many. To address these pressures and to ensure that community pharmacies can realise their full potential, Community Pharmacy England have come forward with their own six-point plan. Firstly, as I've mentioned, pharmacy funding should be reformed so as to give pharmacies a long-term, economically sustainable funding agreement. Secondly, a common conditions service should be developed and implemented so as to allow patients to have walk-in consultations for minor conditions. This would provide accessible care and would ease pressure on general practice. Thirdly, community pharmacies should look to build on other clinical service areas such as vaccinations, women's health, and long-term conditions management for, say, asthma and diabetes, using independent prescribing rights. In this way, pharmacy can do a great deal in key NHS priority areas and will help get the health service back onto a sustainable footing. Fourthly, the medicines market must be reformed so as to get out of the situation that we are now in, where pharmacies are dispensing some medicines at a loss and patients are facing long delays for medicines. Fifthly, regulatory burdens should be reviewed and, where necessary, should be removed, so as to make running community pharmacies easier and to seek to limit the increasing cost of service provision. Sixth point, and finally, a long-term plan for the community pharmacy workforce should be produced that both ensures that pharmacies can keep their doors open and enables them to retain pharmacists in local pharmacies. So, Mark, in many respects, this debate is a trailer for the main attraction, which takes place next Tuesday when Community Pharmacy England launched their vision for community pharmacy as prepared by the King's Fund and the Nuffield Trust. The delivery plan for recovering access to primary care, in that delivery plan, the government undertook to continue to engage with the sector with specific reference to this particular piece of work which is being published next Tuesday. I would urge the government to adhere to this commitment, which is vital, so as to not only rebuild primary care, but also to give community pharmacies a sustainable and viable future, thereby ensuring that after 170 years, they remain part and parcel of the fabric of our towns and cities. Thank you.
Remind members that they need to bob if they wish to be called